Dr. Stephen Mobley, and I want to talk to you about postoperative pain management. We're using the latest guidelines to help you get through your surgical recovery. You're never going to be completely out of pain, and that's a pretty important concept. All of the pain medication is there to make the pain, shall we say, bearable or manageable. You can't expect to be in a state where you feel no pain. Your pain will be worse for the first 1 to 3 days, so always hang in there. It gets better with each day. Let me use this illustration to talk to you about how we're managing pain with a 3-medication pain regimen. So let's imagine that this is a 24-hour day. So what you want to do is every 12 hours, start a baseline of pain relief in your body by taking the 100 milligram Celebrex tablet. I always find it's easiest to take it at the same hour of the day, meaning if you take it at 7 a.m., then take it at 7 p.m. Or if you take it at 8 a.m., 8 p.m., so on. That way you know that you're actually keeping the blood levels of this medication fairly consistent in your system. That's one of your baselines. Now, as the little diagram shows, every 6 hours you can take 2 regular strength Tylenol tablets. Very important that it's 2 regular strength. Regular strength tablets are 325 milligrams. The extra strengths would be too much Tylenol in your system for 24 hours. So every 6 hours, even if you're not hurting for the first 2 or 3 days, take 2 regular strength Tylenol tablets every 6 hours, which is being built in to this 24-hour program to manage your pain. Now, if the Celebrex and the Tylenol, which each block pain in different ways, is not working, that's where you have the prescription narcotic. We call that breakthrough pain. And for breakthrough pain, you want to use the narcotic we've prescribed you, taking 1 to 2 tablets every 4 to 6 hours. There's been a growing national trend away from narcotics. You don't need to be afraid of them, but you still want to use them as little as possible, using some common sense. So if you're hurting, if you've taken your Tylenol, if you've taken your Celebrex, and you're still having pain somewhere on this theoretical sort of 24-hour time cycle, it's okay to augment the pain relief with maybe try, what I usually like to recommend is take 1 narcotic tablet, and remember that the moment you swallow it until you actually feel the pain relief is about 45 minutes. So take 1, give it about 45 minutes to work, and then take a second one. If you're still having pain after all of that, reach out to our office and we can see what else we can do. But honestly, that is about the maximum we can do from an outpatient pain relief. Short of that, you'd be admitted to an ER and given IV morphine or something, which essentially never happens in a practice such as mine. When you're going through this, if you're one of our patients who's had, say, a facelift, neck lift, or other procedure where your face sort of has that mummy dressing on it, it can be a little bit hard to get food into your mouth when you're wrapped up tightly. So consider a protein shake or something that has a little bit of substance to it that you can drink through a straw. That's always a great first step to get a baseline of food into the stomach, then go with your Tylenol, then go the Celebrex, and again, holding off the narcotic unless you really need it until your stomach is completely settled. One more little concept is in the first night, if your stomach is a little bit unsettled or queasy, what do you do then? Generally speaking, Tylenol is going to be the least upsetting to a queasy stomach. Celebrex would be a close second. The narcotic is almost always going to make a queasy stomach worse. So in that first 24 hours, if you feel like your stomach is upset, if you feel like you're on the verge of maybe going to throw up, take the Tylenol, let it work. Take a little Celebrex, let it work, and don't take the narcotic until your stomach is settled. If you do, you'll usually throw up and you'll end up feeling worse in the end. So that's just a good little words of advice to get you through that first 24 hours if your stomach is not well settled.